Hi, my name is Summer Johnson. This is the Nursing 650 Physical Examination project for Northern Arizona University. I'm going to wash my hands and put on some gloves. Hi, my name is Summer. I'm a nurse practitioner student with Northern Arizona University. Could you tell me your name and date of birth and what day it is?
Brandon Johnson, 12/21/76, Thursday.
Perfect. And why are you here today, Brandon?
Just for a physical.
Okay. You feeling okay today?
Yeah.
Great. Okay. First thing I'm going to do is I'm just going to check your pulse really quick. And your respiratory rate. So just breathe normally. So pulse rate is 64. And respirations are 20 per minute. Great, thank you for that. Just gonna look at your overall appearance. You appear to be dressed appropriately for the weather. Your clothes are clean. Your hair is groomed. It looks like you shower pretty frequently. Do you have any concerns today while we do this exam? No? Okay. Looking at your fingers, your fingernail beds, everything looks good there too. So I'm gonna go ahead and start with your head. Is it okay to touch you during this exam?
Yes.
Okay. So I'm just gonna feel here. The head is normal cephalic. I don't see any concerns of breakdown in the skin, any masses or lumps. The hair looks healthy. There is no alopecia noted. Any tenderness as I'm touching your head?
No.
Perfect. Go ahead and just shrug your shoulders for me. Perfect. And move your head side to side and then front and back. Great. Good range of motion. I'm going to palpate your neck. Tell me if you feel any tenderness. Any tenderness at all? Okay. So your lymph nodes feel normal. The thyroid is normal and in place. There is no sign of any type of goiter or any concern like that. Perfect. Okay, I'm going to go ahead, just palpate your jugular veins. Good, there's no JVD noted either, no jugular vein distension. I'm going to start looking at your eyes now. Let me get one of my tools here. This little light I'm going to shine just to see how well your eyes react to light. So just look straight ahead. Good. Pupils are equal and reactive to light. This is a retinoscope. I'm just going to look into your eyes. Retina looks good. Found the red reflex. Bilaterally, we're looking good. I'm going to look at your sclera. Sclera is white. And conjunctiva is pink. Patient is wearing contact lenses. Can you go ahead and just follow my finger? Good. Range of motion of the eyes is good. And I'm going to check your peripheral vision. I want you just to look straight ahead and tell me when you see something in your peripheral vision moving towards you. Good.
Now.
Good. And how many fingers am I holding up?
2.
And
2.
Good. Very good. Okay, I'm going to go ahead and look at your ears now with my otoscope. So I'm looking at the tympanic membrane in the ears. It is pearly white to gray. It is intact. The outside of the ear and the pinna is intact. There is no buildup of cerumen in the ear canal. And on this ear, I'm doing the same thing. Tympanic membrane, pearly gray to white. No cerumen buildup. And palpating the outside of the ears, including the pinna, I don't feel any abnormalities. Any tenderness when I touch your ears?
No.
Okay. Ears and eyes are symmetrical in the face. The nose is midline, and I'm going to go ahead and check that now. Just looking at your nares. The nares are patent. Any problems breathing through your nose at home? Okay. I'm going to go ahead and just palpate your sinus cavities. Tell me if you feel any tenderness. Any issues? Okay. Sinus cavities feel normal. Put this down. I'm going to grab my tongue depressor, and we're going to examine your mouth and your throat. So I want you, the first thing I want you to do is open up really wide and stick your tongue out. I'm going to put this depressor on your tongue. And I want you to say ah. Good. Very good. The uvula is midline and moves appropriately with motion. Looking at your gums and your teeth. There's no signs of periodontal disease. Gums are pink and appropriate. No signs of tooth decay. Great. And the mucosal membranes are nice and moist. Any questions so far? Okay, you're doing okay?
Yep.
I'm going to go ahead and inspect your back and your lungs. See how your lung expansion looks. Looking from the back, the lung expansion looks normal. I'm standing behind you, not kneeling. And I'm going to have you just say 99 when you feel me touch you, okay?
99, 99, 99, 99.
Perfect. Tactile fremitus is normal. Lung expansion is normal. I'm going to listen to your lungs from the back. Just breathe normally for me. Good. Your lungs sound normal. I'm looking at the spinous process on the back, and I'm going to go ahead and palpate down. Back contours appropriately. No issues with the spinous process. As I'm palpating, do you have any tenderness?
No.
Okay, perfect. Contour of the back looks good. And looking at the skin on your back, pretending you don't have a shirt on, I don't see any signs of skin abnormalities, lesions, moles to be concerned about, anything like that. I'm going to go ahead and move to the front now. And I'm going to just look at your chest and your abdomen. Again, we're pretending that your shirt is off for this exam. I don't note any asymmetrical issues. Everything is where it's supposed to be. There's no skin breakdown, no skin or muscular issues that I note. I'm going to go ahead and listen to your heart and lung sounds from the front. First thing I'm going to do is I'm going to listen to your heart valves. Okay, so we're going to start with your aortic valve, tricuspid valve, mitral valve, first pulmonic valve, second pulmonic valve, and then the PMI, located at the apex of the heart. Good. Now I'm listening to your lung sounds. Just breathe normal. Listen on the sides here. Perfect. So lung sounds are clear in all fields from all directions. I don't notice any regurgitation of your valves. Normal S1, S2 heart tones, no murmurs, gallops, rubs, or clicks noted. Do you have any concerns about your heart or your lungs? Okay, everything sounds good. I'm going to go ahead and do the same thing. Just listen to them while you're lying down. So I'm going to have you just lay down here on your exam, and then we'll move on to your GI and your abdominal exam. Again, I'm just going to listen to your heart sounds. Good. Heart and lungs still sound great. I'm going to go ahead and just inspect your abdomen. I don't see any signs of any abdominal abnormalities in the skin. The umbilicus is midline in the abdomen. I'm going to go ahead and auscultate all 4 of your quadrants. Just listen to your belly sounds. So you have normal vowel tones through all 4 quadrants. I'm going to go ahead and percuss. This is just giving me an idea of where the different structures are within your abdominal cavity. Dull over the liver, as it should be. Tympanic over the stomach and over the intestines. Now I'm going to palpate. Tell me if you feel any tenderness. Any tenderness noted? Okay. Everything feels good. I didn't appreciate any splenic outline, which means your spleen is not enlarged or inflamed. The liver felt normal in size, and everything else felt soft and non-tender. I'm going to go ahead while you're laying down. I'm going to observe your legs, your lower extremities. Both of your legs appear to be of the same length. Your knees are midline with each other. No abnormalities noted. As I'm feeling your muscle, the muscular structure is normal. No signs of atrophy. No masses noted in the legs. I do see some scarring on your legs. What are the scars from?
Just from mountain biking.
Okay. They're not causing you any problems? Okay. I'm going to go ahead and see how well your range of motion is with your joints, including your hip and your knee joint. Perfect. Good. And then can you rotate your ankles for me? Great. I'm going to go ahead and appreciate your pedal pulses here. Dorsalis pedal pulses are present. And post-tibial and tibial pulses are present. Good. Okay, I'm going to have you go ahead and sit on the side of the bed. Any questions for me so far? Okay. This part I'm going to check your reflexes. Let's see. We're going to check your bicep reflex, your tricep reflex, your brachial reflex on both of your upper extremities, and then we'll move to your legs, okay? So first one I'm going to check is your tricep reflex. Bicep reflex. Good. Good. Positive reflexes. I'm going to check your patellar reflex. Positive. Good. And your Achilles on each leg and the plantar. Good. So you have positive, good reflexes. Can you move your leg from the knee, your foot from your knee to your shin, down your shin? Perfect. And on the other? Great. Good job. Go ahead and put your hands out in front of you like you're going to play patty cake and clap over 5 times. And do the other hand. Good. Very good. Now I want you to take your thumb and touch each of your fingers. Great. And now I want you to take your finger and touch your nose and then come out and touch my finger 5 times. Good. And then same with this one. Good. Perfect. I'm going to have you just stand up and walk to the window and back for me. Great job. You have really good coordination. I'm going to listen to your tactile front really quick here with my hands on your back. Can you just say 99 for me?
99, 99, 99.
Perfect. Good. Okay. Do you have any questions or concerns about your physical exam today? Okay. I think that you appear to be a pretty healthy person, and I think you've done really good. Thank you for participating in this. I'm going to go wash my hands, and we'll be done.